Hattiesburg, it's Toby Barker. Thank you for joining us tonight, and I hope that you all will remain weather aware as we approach severe weather potentially approaches our area. First, we want to thank you for your patience and your cooperation over the past month. With good personal and collective decisions, we have seen the 5-day average of new positive cases for the Hattiesburg metro area begin to come down. While we are still seeing multiple new cases per day, sometimes in the double digits, and while we are seeing some of the higher hospitalization rates for COVID-related patients, we believe that we are making measured progress toward our two goals. And those two goals are, first, protecting vulnerable populations. Those are people over the age of 60 and those who have underlying or chronic health conditions. And secondly, preventing overrun of our healthcare system by slowing the spread in our community. I know parts of the past month have been inconvenient. And at this point, people are getting tired, frustrated, angry, lonely, and just ready to get out of the house. Those feelings are understandable, and they're okay to have. In fact, in the midst of all the sheltering in place and wearing of masks and social distancing, I hope that you're taking care of yourself. I know this is hard. I know it's hard to not see your family for over a month. I know it's hard to explain to your children why they cannot see their friends. I know people are worried about livelihoods and worried about getting their unemployment straight and wondering when their next job opportunity might come. These worries and fears naturally come with questions. When will this be over? When can I open my business again? When can I go back to work? When can I not be afraid of going out into the community? And when will things get back to how they were? These questions are very human responses to the unprecedented times in which we live. And as your mayor, I wish I had answers to all of them. However, the truth is, I don't know. At least not yet. And as I have thought through what our next steps as a community might be in untangling a really messy situation, and what any reopening of our economy might look like, there are a few sobering realities that we must recognize. First, the threat of COVID-19 will be with us until there is a vaccine or an effective treatment. Even though our number of new positive cases may go down, this coronavirus will continue to pose a deadly threat to the elderly and to those with underlying or chronic health conditions. Those at risk will continue to be at risk until there is a vaccine or a treatment. And that timeline could be 12 months, 18 months, or longer, which brings us to our second reality. We cannot keep parts of the Hattiesburg economy shut down forever. The entire city cannot shelter in place forever. Aside from the economic ramifications, the mental health of our citizens cannot weather a shutdown for that long. Life may look different, but we have to find creative ways to get people back to work or at least experiencing some sense of community. However, in thinking through how and when to do that, we need to look to history and learn from other cities. The Spanish flu pandemic of 1918 gives guidance and provides warnings about the threats of opening things up too early. Other cities, whether in New York, New England, or California, provide some insight into some of the most severe health and social consequences of this virus. In taking these things into account, we can see what our future holds based on a particular action. And finally, we know that collaboration and partnerships work. It's how we've gotten this far. Going forward, we must continue to listen to our medical community, dialogue with our businesses, and be honest with you about trade-offs that may have to occur as we chart a course forward. We know that the months ahead will likely include more testing, diagnostic, antibody, community, all of it. It will likely include the wearing of masks to reduce risk to ourselves and to each other. As we have done with every decision, we try and see the landscape for what it is and what it could be. We try to put knowledgeable people at the table, sharing information and getting buy-in ahead of time. This approach recognizes that one person does not have all the answers, and we are better when we solve problems together. Understanding these realities, I believe a team approach is best in navigating the uncertain times that lay ahead. Tonight, I am announcing a working group of community members to help guide our city forward in withstanding and recovering from COVID-19. This group will include voices from public, private, healthcare, faith, philanthropy, tourism, and restaurant industries. Together, we will build consensus on how closely to follow guidance and timelines from the state and federal government, understanding that the unique needs of Hattiesburg might not be the same as other parts of the state or country. We will look at local testing data. We will look at best practices. Ultimately, I and other leaders want to make decisions that are in the best interest of everyone in Hattiesburg. And having people who know their fields and know their business is key in making the best decisions. The group of individuals I have selected to be on this working group include, from our healthcare organizations of Forest General, Merit Health Wesley, Hattiesburg Clinic, Southeast Mississippi Rural Health Initiative, the City of Hattiesburg Employee Health Clinic, and Pine Belt Mental Health. They include Phyllis Chambers Berry, Dr. Rambod Rubash, Tracy Rouse, Dr. Stephen Farrell, Andy Woodard, Dr. Brian Batson, Karen Newell, Sherry Siggers, and Dr. Rita Porter. From the public sector, it will include David Hogan, President of the Board of Supervisors for Forest County, Jody Waits, Administrator of Lamar County, State Representative Missy McGee, State Senator Juan Barnett, and Glenn Moore from Forest County Emergency Management. Representing our private sector, Chad Edmondson of Leeway Financial, Jonathan Krebs of Horn LLP, Valencia Williamson and Ty Jackson from the ADP, Jerome Brown and Hoppy Cole from the First, a National Banking Association, Carlos Flores of Jeffcoat Fence, Ab Payne of Payne Companies, Roman Gailey of South Group, Bernard Green of Global Green Insurance, and Chamberlain Crothers of SVN Realty. And from our hospitality and restaurant industry, Marlo Dorsey of Visit Hattiesburg, Frank James of Hilton Garden Inn, Nelson Haskin of Blue Jazz, Diana Pennington Hembry of Keg and Barrel, Chris Ortego of Cotton Blues, and Rebecca Chandler of HCLO and Hattiesburg Ballroom and Beyond. From our faith-based and philanthropic organizations, Carlos Wilson of Ebenezer Baptist, Jeff Clark of Venture Church, Tracy Fowler of the United Way, Michael Dixon of the Pine Belt Foundation, Reginald Woolard of Shady Grove Baptist, and Father Tommy Conway of St. Fabian's, and David Martinez of Iglesia Via. We're also glad to have from our community 2 members who are part of the Governor's COVID-19 Task Force, and that includes Robert St. John of New South Restaurant Group and Jonathan Jones of Jones Companies. These individuals and others will shape what our community's approach will be going forward. Now, don't get me wrong, hard decisions are ahead. As a city, as we wrestle with declining tax revenues, we are having difficult conversations about what the next weeks and months ahead. We, like businesses, will have to make tough choices. But know that we will not make policy decisions based on social media hashtags or from conspiracy theories from right-wing or left-wing news organizations. We want facts, real data, and responsible decision-making. With that said, I need something from you. As we go forward, I realize that everyone's patience will be tested. At certain points, people will naturally and understandably want to just open things up. But we must also remember that those most at risk with this disease cannot be dismissed as a mere category of people who might simply have to deal with the consequences of COVID-19. These, the vulnerable, are our fellow citizens. They have names and faces. So before we voice our support to simply throw the gates open and let the weak fend for themselves, we need to identify who in our lives we are talking about, who we are willing to potentially put in harm's way in a futile attempt to go back to the way things were 2 months ago. These are our parents and grandparents. These are our friends, co-workers, neighbors, and fellow church members, any of whom could be dealing with cancer treatments, diabetes, COPD, or some other chronic ailment. These individuals, ones we know, are most at risk. Because of this, we will exercise caution, and we encourage you to speak with compassion as we go forward. Your words have power, and right now, we need at our most basic level to simply to be kind to one another and show empathy to each other. In the end, we will get through this. But I want us to look back at this time years from now and be proud of how our community responded. I want us to look back one day and know beyond a shadow of a doubt that the best of ourselves showed up each and every day. I ask you to help us do just that.